back to Insight. We're at Indiana Physical Therapy, and we want to talk to Mary here about what is it, sports performance. What's that?
So Indiana Physical Therapy is launching a sports performance program. And what that is, we've noticed in the community there's a need where after an injury, you get discharged from physical therapy, but you're not quite ready to return to your sport 100%.
Okay.
So we're trying to fill that gap. So say you tore your ACL in your knee, all right, and I rehabbed you, and you're okay, but you're not ready for contact. You might not be ready for, the high level impact, all right. You would go to our sports performance program, and they would do a functional screen on you and take a look, is your right leg equal to your left? How are you moving? How are you squatting? And clear up some of that more dysfunction.
Mm-hmm. So is that, I guess I'm trying to figure out what the difference is there. Is some of that psychological, where as an athlete, I just want to know for sure that I'm back to 100%?
Oh, absolutely. A lot of it is just learning how to trust that injured extremity again. And we would do that with you. But it's not, what we want to do isn't, increasing your 40 time or increasing your vertical, okay? We want to clear up the dysfunction. What's the point of being able to do all these plyometrics if your knees cave in and you have no glutes, okay? We want to make sure everything is good to go, so then when you go and return to play, you have a decreased risk of re-injuring that body part or the other.
Yeah, I guess I never thought about the difference between being able to, okay, you're back to, you're discharged because you can go walk again.
Right. On paper, you look good. Your strength's back and your motion's back, but are you really safe, to pivot and to cut? And that's what we want to do.
And here in Fort Wayne, are the most people that would be in this high school athletes?
High school athletes, we even want to cater to like the middle school athletes who are just kind of getting in their groove of their sport and maybe clearing up some dysfunction before injuries actually happen. Also, runners are welcome. The average person who wants to get a little bit more fit, everyone is welcome to this. That's the great part about our program is anyone can do it. It doesn't have to be a high school athlete who's looking on to, go on to college.
And would this include maybe in a non-contact sport like running, maybe the reason I was injured is because of some imbalance or something like that you can fix so that I don't re-injure myself?
Exactly, yes. So maybe something that doesn't need formal physical therapy, maybe you're a runner and, man, every year my hamstring flares up and I don't understand why, not something that needs that higher level skill of physical therapy, but something that we can screen, take a look, is there a symmetrical problem, is there a soft tissue restriction, and then we would work on that with you.
Okay, now is this something that's going to last longer than physical therapy? Is this something that would be seasonal? How do you envision this maybe?
So we would initially screen you, and then we would set you up on some training sessions, maybe twice a week, maybe 3 times a week, depending on your need. They would last about 30 minutes to 45 minutes. We envision, hopefully it clearing up, within, 4, at most 8 weeks, you would need this.
All right. It sounds like a great program and really is going to fit a great need here in Fort Wayne and around the area. If you want more to find out about all the locations Indiana Physical Therapy is located, or to find out more about sports performance, you can go to their webpage, which is indianapt.com. We will be right back on Insight.